Good afternoon. My name is Marina Izmailovich. I'm PhD student from Karaganda Medical University, Kazakhstan. The topic of my investigation is association between serum 25-hydroxyvitamin D concentration and severity of seasonal allergic rhinitis in Kazakhstan. Vitamin D deficiency remains one of the major public health issues affecting at least 1 billion people worldwide. Atmospheric pollution might further deteriorate vitamin D deficiency, and the Karaganda region of Kazakhstan is characterized by high levels of pollutants in the atmospheric air, exceeding the maximum permissible concentration. Patients with allergic disorders, and in particular with respiratory allergy, are susceptible for vitamin D deficiency. The study was aimed to assess the level of serum 25-hydroxyvitamin D and their association with the severity of seasonal allergic rhinitis in the Karaganda region, Republic of Kazakhstan. Our study was cross-sectional, and this cross-sectional study included 416 patients with seasonal allergic rhinitis, aged till 18 to 65 years. And the mean age 39 plus minus 8 years. 267 of whom were females and 149 were males. The serum concentration of 25-hydroxyvitamin D was measured with the Beckman culture automatic modular analyzer USA between June 1st, 2019 and September 31st, 2019. And vitamin D deficiency was defined as a serum concentration of 25-hydroxyvitamin D below 20 nanogram of milliliters. The value of the vitamin D level was expressed as median, and as you can see, the median concentration of 25-hydroxyvitamin D in blood serum was below the reference threshold and amounted to 16.1 nanogram of milliliters. And 75% of patients with seasonal allergic rhinitis had vitamin D deficiency. And this is a very high rate among the entire population. Besides, it is worth noting that the deficient level of vitamin D was common in all age categories. As you can see, 75.6% of patients from 18 till 39 years old had the vitamin D deficiency. And among the category of age category from 40 till 59 years old had the 78.4%. And 64.6% of patients in age category more than 60 years old had the vitamin D deficiency level. Of interest is the fact that low serum vitamin D concentration was more prevalent in female patients with the seasonal allergic rhinitis. It's 82.8% as compared with the male patients who had the 61.1% of these patients had the vitamin D deficiency. Of interest, the fact that low serum concentration correlated with the severity of symptoms. It's nasal congestion and nasal discharge, sneezing, itchy nose and eyes, and tearing. As you can see, the data shows there is a strong negative correlation between blood, vitamin D, and the severity of symptoms such as the nasal congestions and nasal discharge. As for the symptoms of sneezing, itching nose and eyes, and tearing, they have an average negative correlation with the level of vitamin D in the blood. It means they have the minus 0.67. And this shows that the lower the vitamin D level, the more severe the symptom of allergic rhinitis. And in conclusion, I want to say that nowadays vitamin D deficiency remains an unresolved problem in Kazakhstan patients with the seasonal allergic rhinitis. In fact, vitamin D is prohormone with the immunomodulating properties. And according to our study, the significant part of patients with allergic rhinitis residing in Karaganda region of Kazakhstan had deficient status of 25 hydroxyvitamin D, and this correlated with the severity of symptoms. And the outcomes of our study could be interest for both clinical physicians and the public health professionals who could envisage prevalence strategies to tackle this problem. Thank you for your attention. Have a good day.